everyone, and welcome. My name is Alicia Pikovich, and I currently hold a bachelor's degree in criminal justice with a minor in addiction from John Jay College of Criminal Justice in New York. I am working toward a master's degree as a licensed mental health counselor at Cornerstone University, Michigan. I also have a certification from New York Presbyterian Hospital in Queens, New York City, as a professional advocate for victims of trauma, domestic abuse, and sexual assault. This presentation is going to focus on intimate partner violence, clinical insights, and trauma-informed interventions. We'll delve into the complexities of intimate partner violence, or IPV, and explore how trauma-informed advocacy and crisis intervention can make a meaningful impact. This is a crucial area of study as IPV affects individuals and communities across all backgrounds. Understanding and addressing these issues are vital for fostering safer environments for everyone. We're about to explore the core learning objectives, which will guide our discussion and ensure we cover the necessary ground to effectively support those impacted by IPV. If any time during the presentation you have any questions, concerns, remarks, please drop them below in the comments section. On your handout, it will focus on the highlights of this presentation. Please have a pen if you'd like to take notes. So, we are here to enhance our understanding of intimate partner violence, IPV, through these essential learning objectives. First, we'll define and identify the different types of IPV. It's crucial to recognize the various forms this violence can manifest, ranging from physical to psychological. Second, grasping the psychological and physical effects of IPV is vital. These impacts can be profound and long-lasting for those who experience them. Third, we'll pinpoint trauma-informed clinical responses. This approach ensures that we offer support and acknowledges that respects the trauma faced by survivors. Finally, we'll delve into culturally sensitive approaches to care. Each person's experience is distinct, and cultural factors play a crucial role in effective interventions. By concentrating on these objectives, we can enhance our advocacy and support for those affected by IPV, nurturing a safer and more compassionate environment for everyone. Let's dive into our introduction to intimate partner violence, or IPV. IPV is a serious issue that involves behavior by a current or former intimate partner causing harm, whether it's physical, sexual, or psychological. This encompasses acts like physical aggression, sexual coercion, psychological abuse, and controlling behaviors. The statistics are quite staggering. According to the CDC, in 2021, 1 in 4 women and 1 in 10 men experience IPV at some point. It's crucial to highlight that IPV is a public health issue affecting people all across demographics. No one is immune, and understanding this approach helps us with the matter and the seriousness it deserves. Together, we'll explore how this impacts individuals and communities and how we can make a difference through informed interventions. Intimate partner violence can manifest in various forms, often occurring simultaneously. Physical abuse is typically the first type that comes to mind, encompassing actions such as hitting, choking, or even the use of weapons. Sexual abuse involves forced sexual acts, coercing someone into sexual activities, or controlling reproductive choices. Emotional or psychological abuse can include persistent threats, insults, humiliation, or isolating someone from their friends and family. Financial abuse occurs when the abuser exercises control over finances, prohibits the partner from working, or sabotages their job prospects to ensure dependency. In today's digital age, digital abuse has also become prevalent. This includes tracking someone via GPS, accessing their phone without consent, or online harassment. A notable case highlighting these issues is that of Rihanna and Chris Brown. Even after a highly publicized violent incident, Rihanna briefly reunited with him, illustrating that abuse extends beyond a single traumatic event. It deeply intertwines with control, complex emotions, and obstacles that can make leaving the situation incredibly challenging. Intimate partner violence significantly affects both mental and physical health, often leaving survivors with conditions such as post traumatic stress disorder, PTSD, depression, anxiety, and substance abuse. On a physical level, IPV can result in chronic pain, traumatic brain injuries, and reproductive health issues. Notably, many trauma responses like hypervigilance or emotional numbness can be viewed as adaptive survival mechanisms developed in reaction to persistent threats. Research reveals the profound nature of this impact. Maza and others 2021 describe a psychological feedback loop where abuse leads to depression, diminished self esteem, and increased reliance on the abuser, which further entrenches victimization. Over a 20-year period, Clemente Teixeira and others 2022 found that women with a history of IPV experience significantly higher rates of chronic pain, gastrointestinal disorders, gynecological issues, and cardiovascular diseases compared to those without IPV exposure. Similarly, Thompson and others 2006 reported that IPV survivors face a 2 to 3-fold increased rate of long-term physical disabilities, with the worst health outcomes occurring in those who experience both physical and psychological abuse. These findings underscore the urgent need for comprehensive, trauma-informed care that addresses the intricate relationship between the mental and physical consequences of IPV. Let's explore the barriers to leaving abusive relationships. It's important to understand the complexity and deeply rooted challenges that individuals may face. Firstly, emotional dependency and trauma bonding can create a powerful attachment to the abuser, making it difficult to leave. These bonds are often reinforced by fear of retaliation or concerns for a child's safety. Imagine the internal struggle when financial instability also plays a role, leaving one feeling trapped. Cultural and religious pressures may further complicate the decision to leave. These factors can create a sense of obligation or guilt about breaking away from the relationship. Consider the case of Pamela Anderson, where IPV occurred with the child present. This highlights the added dimension of child safety and the fear of potential repercussions. Maza and others 2021 pointed out how depression and trauma-related cognitive distortions can reinforce feelings of helplessness and entrapment. Over time, repeated exposure may normalize the abuse, adding another layer of complexity to the decision to leave. Understanding these barriers is essential in providing support and fostering a compassionate environment for those seeking help. Let's keep this awareness at the forefront as we aim to support and empower survivors. When discussing intimate partner violence, it's important to consider the varied landscapes within which it occurs. Let's explore how IPV uniquely affects diverse populations. Consider the LGBTQ community, where stigma and a lack of inclusive shelters can exacerbate the challenges survivors face. Immigrants, too, encounter significant obstacles such as language barrier and fears of deportation, which can intensify their vulnerability. Racial and ethnic minorities often face systemic biases that can further complicate their experiences with IPV. This bias can hinder access to resources and support, making it harder for survivors to seek help. Let's remember that IPV transcends demographics. The example of Halle Berry illustrates that abuse can impact anyone, regardless of their fame or external beauty. According to Thompson and others, 2006, The chronicity of IPV is a more potent predictor of poor health outcomes than demographic factors. This underscores the importance of addressing IPV consistently and effectively across all communities. We must strive for inclusive support systems that recognize and address these diverse challenges, ensuring that all survivors have the resources and protection they need. Let's delve into the principles of trauma-informed clinical response. The key principles include safety, trust, collaboration, empowerment, and cultural humility. These principles are essential in creating an environment where individuals feel respected and secure. When we talk about safety, it's about ensuring privacy and adopting a non-judgmental approach. This builds trust, which is crucial for effective collaboration. Empowering individuals involves giving them a voice in their healing process, while cultural humility ensures that their unique backgrounds and experiences are honored. Consider using language that acknowledges the difficulty of their situation, such as asking, "What made it hard to leave at that time?" This opens up a space for honest dialogue and validates their experiences. Can you think of any other ways to open up a conversation? Please leave it in the comments section below. As we move forward, keep in mind how these principles can be integrated into broader awareness efforts. Screening and assessment tools. Let's get into crucial tools that we can use for screening and assessing intimate partner violence, which are essential in ensuring a comprehensive approach to support. First, we have the HITS tool, which stands for Hurt, Insult, Threaten, Scream. This tool is straightforward yet powerful in identifying potential abuse by focusing on core aggressive behaviors. Next is the Danger Assessment tool, specifically designed to evaluate the risk of lethal violence. This tool helps us identify high-risk situations and prioritize immediate interventions to keep individuals safe. The Abuse Assessment Screen, AAS, is another crucial tool in our arsenal. It's a more general screening that helps identify various forms of abuse that an individual may be experiencing. It's important to remember that these screenings should always be conducted privately to ensure the individual's safety and comfort. This privacy not only fosters openness but also respects the confidentiality essential in these sensitive situations. Let's always strive for a thorough and compassionate assessment to guide our support and interventions effectively. Interventions and referrals for those experiencing trauma. Firstly, therapy plays a crucial role. Approaches like CBT, EMDR, and other trauma-focused methods can be transformative. It's important that these are tailored to the individual's needs. Collaboration is vital. Working with shelters, legal aid, and case managers ensure comprehensive support. Remember, safety planning must be personalized and realistic. Consider the case example of Whitney Houston and Bobby Brown, where substance use further complicated intimate partner violence. This highlights the complexity of cases and the importance of integrated care. Clemente Teixeira and others, 2022, found that combining mental health, medical follow-up, and social support significantly improves outcomes. It underscores the need for long-term monitoring, as symptoms can surface years later. By understanding these elements, we can better support individuals on their journey to recovery. As we wrap up our discussion on intimate partner violence, let's focus on 3 important takeaways. Firstly, remember that IPV, while complex, is preventable. Secondly, it's crucial to apply trauma-informed and culturally sensitive care when addressing these issues. Such approaches respect the unique backgrounds and experience of everyone involved. Finally, know that resources are available. The National Domestic Violence Hotline at 800-799-SAFE along with other local shelters and legal aid, can provide critical support. Thank you for your attention and commitment to making a difference. Now, let's dive into an important discussion. What barriers or challenges have you noticed in your practice when working with IPV survivors? What have you learned about IPV in the past? Are you learning about it now? Is there anything in this presentation that I did not bring up or I should have included? Please leave all your concerns, feedback for me in the comments. I will gladly take a look at it and work on it. Again, thank you for everyone for participating in this presentation, and I hope that you learned something from it. And let's continue to help all victims of IPV, of substance abuse, domestic violence, come together and find a solution and treatment. Thank you.